excited to welcome you all to the first of 3 sessions for the second cohort of our learning communities. Today, we will be diving into the topic of integrating behavioral health services for refugees and migrants across a multidisciplinary team. So with me today, serving as our co-host for this learning community is Dr. Brandon Osborne, Senior Research Associate at AMTC and Associates. And I will allow Dr. Brandon to introduce himself.
Thanks, Dr. Mutsa. Again, my name is Brandon Osborne. I'm with AMTC and Associates. It's an absolute privilege to have all of you joining us today as part of this learning community. Your time and presence is a testament to the commitment we all share in addressing the unique and critical behavioral needs of refugees and migrants within our communities. We hope through this learning community that we're able to foster a collaborative environment where we can share knowledge, resources, and best practices. Through our collective experiences and expertise, we aim to enhance the capacity of our organizations, improve service delivery to migrants and refugees, and ultimately make a significant impact within our communities. Through these 3 sessions for this learning community, we hope to open up dialogue through interactive sessions and activities. We will explore various aspects of integration of behavioral health services across multidisciplinary teams. I encourage everyone to actively participate, share your insights, ask questions, and support one another throughout this process. The strength of this learning community lies in our willingness to collaborate and learn from one another. We also hope that as a byproduct of this learning community, you all are able to develop new professional relationships with each other and networks for you to all advance the important work that you're doing. Thank you again for being part of this initiative, and I look forward to the meaningful conversations we'll have ahead. I'd now like to introduce our National Director of the Refugee and Migrant Technical Assistance Center for Behavioral Health, Dr. Elizabeth Ortiz-Mendez.
Good afternoon, everyone. It's wonderful to see so many dedicated professionals here today as we embark on our second learning community group. My name is Dr. Lizzie Ortiz-Mendez, and I am currently serving as a project director for the Refugee and Migrant Technical Assistance Center for Behavioral Health. We are through Southwest Key programs. We are known as RMTAC to shorten our name. RMTAC is a virtual platform that supports providers nationwide who serve refugees and migrants. We are funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Our grant from SAMHSA enables us to offer nationwide support through consultation and technical assistance requests, coaching, and training content, such as the learning community we are hosting today. We also provide online learning modules through our website, www.rmtac.org. You can log in and create an account to access our learning module, which highlights practicing trauma-informed care when providing services to refugees and migrants. Our learning content is designed to address the specific needs of the vulnerable populations you serve. At the inception of our grant, we conducted a needs assessment and literature review to help tailor our learning content and services. The needs assessment includes responses from providers nationwide who gave insight into what is needed to support the work being done for these populations. The literature review examined the past 5 years of best practices for behavioral health care for refugees and migrants throughout the United States. We have also published a newsletter that will be sent out quarterly and are planning to launch a podcast series to support and engage our community. We are fortunate to have a very engaged advisory board with members from various disciplines who provide services across the nation. They help drive and enhance the delivery of our program. Our advisory board members have helped us review our literature, serve as subject matter experts and observers in our learning community sessions, and you will see them engaged in today's session. We value their support. As you begin the learning process with us today, please take some time to review our website. You can submit a consultation and technical assistance request to our team to support your needs in serving refugees and migrants. Remember that this training is just the beginning of how RMTAC can support your learning and your organization. I do want to take a moment to acknowledge and thank the incredible team behind this learning community. Their dedication and hard work have been instrumental in bringing these sessions to life. To my talented staff and the advisory board members, please know your efforts are deeply appreciated and have made this possible. Before I hand it over, I want to encourage you to actively participate in this learning community. Please have your cameras on, use the reaction button, drop comments in the chat, unmute yourselves to talk and interact with each other. This is your learning time and we want you to be fully engaged. Thank you so much. I will now hand it back over to our hosts.
Thank you, Dr. Lizzie. We would like to highlight our agenda. Perfect. As you can see from our agenda for the day, we have a lot of engaging activities coming up. We'll identify the goals and desired outcomes of this learning community. We will hear from our subject matter expert on the topic of multidisciplinary teams, and we will have a couple of opportunities to engage in some rich discussions and activities. I'm excited to introduce our subject matter expert who we will be hearing and learning from shortly. Dr. Marlene Trujillo is the CEO of Spring Branch Community Health Center and is also a member of the RMTAC Advisory Board. Thank you, Dr. Trujillo, for your time and commitment today. I'm also excited to introduce our subject matter experts and facilitators who you will have the opportunity to hear from when we split up into breakout rooms later in this session. Luz Chapa and Esther Rodriguez both serve as clinical consultants on the RMTAC team. And we also have Karen Johnson, the Director of Mental Health Services at Peacemaker Family Center at Trinity Church and also a RMTAC Advisory Board member. Thank you to our dynamic team of subject matter experts and facilitators. Our RMTAC team members, Diana Romero, Sonia Rowlands, Alex Swift, and Titus Ortega Jr. will also be serving as producers within our learning community today. They will help to make sure that everything runs smoothly. And so if you encounter any technical difficulties throughout this session, please feel free to reach out to any of them via chat. Their names and roles appear on their videos. Thank you to the RMTAC team. So at this time, we're now going to dive into what our session entails. The purpose of this learning community is to highlight the importance of utilizing a multidisciplinary team to establish community and social support between mental health providers to better assist refugees and migrants. We have curated this learning community to be an engaging and collaborative format and experience rather than for it to be passive or lecture style. It's not often that we as behavioral healthcare providers get a chance to engage with fellow providers from various disciplines in an environment that allows us to share different perspectives and ideas that we can take away and implement within our own practices. So we hope that today and future upcoming sessions will give you a chance to do so as you interact and share ideas with case managers, psychologists, clinicians, clinical consultants, intake directors, and more. All of these individual positions hold valuable experience and expertise. And so facilitating discussions amongst ourselves will not only enhance our work, but also increase our network of support. So we encourage you today to take full advantage of the resourceful individuals in this session by being an active and engaged participant. The idea of bringing practitioners and experts together was highlighted in the literature review that AMTC and RMTAC completed. The main findings indicated that there's value in discussing strategies to better integrate mental health services within primary care settings to ensure a holistic approach to health. And the final report is titled The Behavioral Health Needs of Refugee and Migrant Populations in the United States, a Scoping Review. It will be available for you all to access on our website soon. And as Dr. Lizzie mentioned earlier, RMTAC conducted a needs assessment to evaluate the current resources and identify gaps for refugee and migrant populations, as well as the providers that serve them. In this assessment, provider feedback indicated a high interest in training and technical assistance in topics related to referral to services or agencies, which really ties into the theme of this learning community. So In order for us to highlight the importance of utilizing a multidisciplinary team, we need to know what it is. A multidisciplinary team consists of members who bring unique knowledge and expertise from various disciplines. By working together to integrate their services, they provide a more holistic approach to treatment. And this approach is particularly advantageous for refugees and migrants because of their unique and complex needs. So what exactly are the benefits of support and collaboration amongst us behavioral healthcare professionals, specifically as it relates to refugee and migrant populations? Many refugees and migrants don't seek mental health services due to the various barriers they face at individual, community, health system, and policy levels. As we all know, refugees and migrants are at an increased risk of developing mental health concerns due to high rates of exposure to trauma throughout their migration journey. This, combined with the stresses that they encounter during the resettlement process, has the potential to cause significant emotional distress. This population are amongst the most vulnerable members of society, and the barriers they face to accessing adequate care, specifically mental health care, can lead to prolonged distress. Those barriers include lack of adequate language interpretation services, cultural influences, including stigma associated with seeking mental health support, lack of familiarity with the healthcare system, and poor competency among health providers. So this is where we as providers come in. A key benefit to collaboration and support amongst behavioral health professionals who serve refugee and migrants is that it reduces barriers to mental health services. Research shows that one of the main ways that refugees and migrants access healthcare are through primary healthcare facilities. So if providers within primary healthcare settings and providers within mental health care settings offer integrated services, which means combining the two into a cohesive collaborative setting, it would serve a great benefit to this population by promoting early access to mental health services and providing them with access to practitioners who are trained in cultural and humility practices. Your presence here today is going to produce these and more benefits for the refugees and migrants you serve. So we're now going to move into highlighting what we hope you take away from today's session. By the end of this session of our learning community, you will be able to identify the roles and responsibilities of a multidisciplinary team in addressing the behavioral health needs of refugees and migrants. As providers, we can probably all attest to encountering cases that were complex or challenging. And depending on the setting in which you work, you may have had moments of wishing you could consult with individuals from different disciplines or areas of specialty as you worked to create an effective care plan for your clients. Well, a part of this learning community will involve the opportunity to analyze a case study of a migrant client for you to develop effective strategies that you can use to create a holistic care plan. And our hope is that you'll be able to utilize some of these strategies in your current work and treatment of complex cases. Please note that the case study we discussed may contain some topics that are sensitive and potentially challenging. So we encourage you to prioritize your well-being throughout these discussions. We also hope that this learning community is an opportunity to engage behavioral healthcare providers from various disciplines, work environments, and varying degrees of experiences to all be in one virtual room and collaborate in a way that will positively impact the refugee and migrant populations we serve. It's also crucial for us to create a virtual space that is safe, supportive, and highlights the importance of each role we hold within the different disciplines of the behavioral healthcare field. We hope that you will have an opportunity to gain new perspectives through shared experiences and hearing from experts within the field, and that you walk away from this session and learning community as a whole, having learned best strategies and practices for addressing complex cases involving refugees and migrants.
Thank you, Dr. Mutsa. I'd like to introduce our subject matter expert and guest speaker today. Dr. Marlene J. Trujillo is Chief Executive Officer of the Spring Branch Community Health Center, a federally qualified health center in the greater Houston area in Texas. Dr. Trujillo brings over 15 years of experience in community health and addressing health disparities in medically underserved areas. As a first-generation American, Dr. Trujillo was born to Mexican and Colombian immigrant parents and has lived her entire life in the Spring Branch community of Northwest Houston. Having experienced similar challenges as a child, Dr. Trujillo understands the healthcare and social service needs of vulnerable populations. She experienced medical tourism at an early age, traveling to the Mexican border city of Matamoros for medical and dental care. As CEO at Spring Branch Community Health Center, Dr. Trujillo is responsible for leading strategic planning in collaboration with the board of directors, ensuring the delivery of high-quality patient care, leading a team of high performers while fostering a positive organizational culture, building and maintaining partner relationships, and ensuring compliance with all regulatory bodies. Dr. Trujillo, thank you for joining us today, and I'll leave it to you.
Thank you so much. And it's good to see everyone online. Thank you for inviting me, and I look forward to having some deeper discussions in our smaller groups. But let me tell you about what's happening in our world in Houston. So the slides are kind of focused on addressing health inequities in medically underserved communities, which we target in the population of Houston. There is a northwest-west corridor that we target. The population is highly Hispanic, and I'll give you some stats on that so you kind of get a reference of where we are in the community. So can you go to the next slide? Thank you. So as mentioned before, the Spring Branch Community Health Center is a private nonprofit organization. We target the population that is uninsured and underserved, primarily women and children who are needing access to healthcare services in the Northwest and Houston area. And access is basically access for everyone. We try to make sure that we can offer services that include everything from primary care to some specialty services, including OB, dental, and mental health services. And they're all under one roof. So we kind of become a one-stop shop for the community as a community health center. And we do have several locations, but the focus is to make sure that we have all services under one roof. So when one walks into the facility, they can access all the services in a culturally competent and patient-centered environment for all. And just some stats about our nonprofit. It was established in 2003. We began offering healthcare services in 2004 as a faith-based charity clinic. Community leaders got together and decided that it was important for us to serve the community, especially in the area of women's health services and pregnant women that were entering the ER with no health care and no prenatal care. So it was important for us to fill that gap. And in 2005, we did receive a federal funding and a designation as a federally qualified health center. There are federally qualified health centers throughout the nation. We have many in every state, including Puerto Rico. We have several health centers there. And every location receives some sort of federal funding in order to serve the uninsured and underserved community. But currently we have 8 clinic locations and 2 mobile health clinics. They all come in different sizes and shapes to serve the community. In our population for 2023, we served 28,000 individuals, and we offered healthcare visits, which includes the primary care services, the patient care population services, and a lot of the social services. And you can see that outlined there, 95,000 and 35,000. We aren't the biggest, but we're not the smallest health center in the Houston area. Demographics in our population profile, as you can see, 92.5% of the population lived at or below 200% of the federal poverty level. So we served a very specific population that is in need of health services. They don't have the means to have private insurance, but they do qualify for Medicaid and sometimes CHIP as well. The patient population that we serve is consistently women and children. So 67% of the population that we serve is identified as women. They're also Hispanic or Latino, and they do prefer their native language, which is Spanish. So 53% of them are being served in their Spanish-speaking language, which all of our staff and population in those community speak Spanish. A few dialects, but mainly Spanish. And of those, the federal poverty level allows them to qualify for our services. So you have that stat there. So what we wanted to focus on was, how does the patient follow a journey when they walk into our health center. When they walk into our health center, they're in need of health services, but there's an abundance of other services that we offer within our community health center. And as you can see here, the list, not only primary care services, which is adult medicine, pediatric, OB-GYN, behavioral health, dental, and social services. So offering all of the services within the facility allows for a referral basis between the health center services when someone walks in the door. So once you become a patient of the health center, you also have access to housing services, homelessness programs, care coordination, health education, community events, and mobile health activities. So you're basically a patient of Spring Branch Community Health Center, and you get access to all of the services once you become an official patient. On the multidisciplinary approach, which is our focus today, we wanted to show how that is connected with the primary care services within our practice. We have sole proprietorships where they offer behavioral health services and psychiatric and psychology services, but all of ours are integrated into the community health center. So what does that exactly mean? So it combines various fields to tackle the complex issue. So as Dr. Majero said earlier, the multidisciplinary approach is a collaboration among professionals. It's an integration of diverse perspective and skills, and really a holistic approach to solving all of the needs of the patient. It's not just one service, it's a combination of services that are being provided. Part of the benefits of having that approach is it avoids re-traumatization, provides additional quality time with members of a team to provide trauma-informed care. So as our providers are serving the population, they're supportive members in the trusted circle of providers. It's not just the family doctor, but you have the dentist, you have the mental health provider, you have the pediatrician. So it's a team-based approach to serving the needs of the population and the patient. It addresses physical, social, behavioral health needs and a whole person approach, a very holistic approach to serving the needs. And as you know, when you walk into the doctor, it's not just about, getting a little script and a prescription and walking out the door. It really is about the care model and the care coordination within the facility. And that's what we focus on, is making sure that you can treat not only the chronic conditions of a patient, but all the other health-related needs when they walk into our facility. And that's a nurturing environment for patient satisfaction and also improved health outcomes. And a little bit about the roles. You have your physician and your treating practitioner, but you also have your medical support staff. We have case managers that allow the care coordination to take place. We have referral models within our health centers where a pediatrician can refer over to a mental health provider. And also we have an opportunity to go from one department to another, from adult medicine to OB-GYN, from OB-GYN to pediatrics, and so on. The behavioral health providers are integrated into the model. They're served in the same space. They're in the clinic. The way ours are set up is it is a team-based approach. The referral specialist is also a key component of making sure that the practitioner or the provider who wants to connect that patient into behavioral health or mental health services has a referral and a link in the health center and is able to provide that care coordination. The consultant psychiatrist, as you can see, is also part of the role and being able to serve the needs of the population. And they're not always on site, but sometimes there's telemedicine in our practice where we can provide telehealth services. So these are the different roles and how we approach the multidisciplinary approach to serving the population in our community. Specifically to behavioral health services, how is that model integrated? We've been pushed from the federal level, from the state level, from the community level to integrate behavioral health service into primary care. We've been talking about that for many, many years, but I think now there is a understanding and a buy-in of how this model actually works when you're out in the community. Because again, it's not just one aspect of healthcare, it's all the health services that need to be addressed for that one patient that you're seeing. So the need for behavioral health integration is, considered one of the priorities also from the presidential priorities in healthcare has always been a movement to make sure that health centers in the community are adding this to their list. Refugees and migrants, specifically in this area, unfortunately, there are some fewer opportunities to receive behavioral health services because of the obvious. They don't have medical insurance. They don't have a lot of cash to pay for services. The opportunities for them to access mental health during a medical visit or a sick visit are much needed, but the access is very, very limited because of the lack of coverage and the lack of special programs for specific population. So there's two models of integration, and we have followed both models in our community health center. There's a psychiatric collaborative model where there's a provider and a manager that provides most of the patient care. There's a consultant psychiatrist that is often off-site. The consultant psychiatrist does not provide direct care, but there is a connection. And then there's also the patient registry between the psychiatrist and the manager and regular caseload. So that is a very I would say a narrow focus collaborative care model that exists, and it still works. There's sole proprietorships out there. The behavioral health integration model on the other end is really treating provider that's integrated into the patient care in need. So it does not require a consulting psychiatrist. You enter the behavioral health services direct. The treating provider manages medications in collaboration with the counselor and the behavioral health provider. And there's regularly caseload review where you have, again, the integrated model to talk to providers within the separate specialties in order to take care of that patient need. So oftentimes you'll see the pediatrician talking to the counselor. You have the case manager, which is able to resolve some of the care needs, and it becomes a team-based approach to solving the needs of the patient that's walking into our facility. And some of the goals that we try to reach is, behavioral health services. We'd like to have it offered at all 8 clinics. Right now, due to some of our recruiting efforts and challenges and funding, you're having to co-locate some of our behavioral health services, and then patients are referred out. We currently have one behavioral integration counselor that is HRSA funded. We're trying to build and hire 4 more. We also have 2 behavioral health providers and a part-time psychiatric consultant. We're trying to add more psychiatric services, but it's really hard to find Spanish-speaking psych services. And when you find them, it's ultimately very expensive to integrate that into your model, but we are still looking. We're also looking to hire more behavioral staff because of our increase in number of patients. We're seeing a lot more needs in the behavioral health, especially in the adolescent population and the women that are pregnant. There is a lot of depression. There is a lot of need to address anxiety, and also to address some of the life challenges that they're presented with. Expanding our services to behavioral health integration is part of our process. We currently have a SUD services. We have substance usage patients, and we're able to manage those with medical treatments as well. So we're using a lot of these extra opportunities to provide access, but I think we're still limited providing the access to the migrant population because there is no billing component attached to it. So working with collaborations and partnership is essential to our ultimate success in this area. So moving on to collaboration. So we can't provide everything within our health center. How do we do that? Working through collaborations and partnerships. This is a clear example of how we handle the 501c3 relationships. We do work with nonprofits. Nonprofits refer to our health center for services. There's many nonprofits in our community. So a lot of the migrant community and the patients in need walk into other nonprofits that know us very well. And then we have a referral relationship into our services. And some examples of those are the Catholic Charities, the YMCA of Greater Houston, and Boys and Girls Club, where we get a lot of our referrals from. On the church side, the faith-based organizations, they also have community departments. They have community liaisons that try to connect the individuals that need more help. And we have a relationship with those churches as well. So there are some examples of how we're handling that. And then on the social services, what's great about the Houston area is that we are a new United Way agency. So United Way utilizes their 911 phone system in order to connect individuals to services, so that we are one of the providers on that list. If someone needs not only mental health services, but also social services or medical services, they're able to connect with us. And the other opportunity that we've had to expand behavioral health services has been co-location. So one of the examples of that is our Raider Care Center. We recently received a grant from United Healthcare for $200,000. We decided that we needed to prioritize the adolescent population that was not coming to our health center. We've had situations where case managers have had to address more personal, complicated discussions with parents, with their high school student, but the parent and the child actually doesn't, or the parent and the student doesn't actually make it to the health center. So we decided to bring our services into the high school, into a safe space for them in order to get them the access. And if you can go to the next slide, I have some pictures of the inside of the facility. So we were able to collaborate with the school district, which is really hard to work with school districts because of our laws here in Texas. But they opened up the door. We were able to secure some funding. And now we're actually in a classroom, well, a small classroom in the high school that has been dedicated to wellness for the adolescent population. So they're getting actual services on site while they're in high school. So this is my information. This is the staff that leads our department. I know there might be some questions, but just wanted to give y'all some reference to what's happening in Texas and how we're collaborating. We're ultimately using all of our resources and connections in order to serve the community. The behavioral health space is a great space, but often we're limited because of funding and the lack of collaboration. And on the other end, we're very fortunate in Spring Branch Community Health Center because we've had 20 years of collaboration and 20 years of relationship that we've been able to strengthen throughout those years, and working with the community in order to get those services and become accessible to the community, especially the migrant community, when we have a population that needs more support than those that can have insurance or apply for Medicaid. So thank you for your time, and I'm more than happy to take any questions about our model, about our services, what's working in our space.
Great. Thank you so much, Dr. Trujillo. I think now we're going to briefly introduce the vignette that will be part of will help part of the breakout activity. And I'm going to transition now to the clinical consultants to begin introducing what that vignette case study is going to look like.
Yes, thank you. Thank you. Good afternoon, everyone. So the clinical consultant team developed a case study for our participants to review. And the purpose of this case study is to analyze the situation during the breakout rooms and together develop effective strategies while using a multidisciplinary approach. So we ask that you please picture this case in your work settings. Though some details may not completely match your duties, we ask that you imagine that they do, and as you work together through this case study together. These discussions will take place in your assigned breakout rooms, where a subject matter expert and facilitator will guide you and encourage small group discussion. And you will also have a producer assigned to these groups who will be taking the notes on the screen.
So each discussion will be guided by one of our subject matter experts or facilitators. After we're done going over the case study vignette, and we return back to the main meeting, we'll ask for folks to share some of the discussion that took place regarding that specific activity. And during this session, there was going to be some guiding questions to think about. It's kind of hard to talk about this without seeing it first, but as soon as we break out, you'll be able to see in detail the full case study vignette as well as the guiding question. So we're going to go ahead and begin that. And during that session, more details will be provided. You'll also get a copy of the specific case study as well, so you can reference it, and it should be shared on the screen, so you'll be able to read it as well. We're going to do another Slido. We want to hear, what was discussed in your group and specifically who you would consult with for guidance on that case. So we'll share the QR code shortly, and then the again, the link to the Slido with the code, and give you a minute or so to access it. So I know you joined us a little late, but you can scan this QR code, or you can go to slido.com and then enter the code 2314808. And then once there, yeah, go ahead and put in your responses. So who would you consult with guidance for that particular case? Okay, supervisor, clinical director, law enforcement, human trafficking specialist, victim advocate, child protective services. I see some folks still typing. And you can obviously enter more than one if you're going to be consulting with multiple folks. Crisis center agency. Okay, I think that's case manager. Okay. Esther or Luz, did you, since you were part of the breakout, and then certainly any participants that want to open up, do you want to share specifically why you'd want to consult with any of these particular folks given the information about the case study?
Absolutely. We had a wonderful discussion, and when we started our group, we identified one of our participants to sort of summarize everything that we discussed. So I'm going to hand that over to Michelle to give us some feedback on why we identified these people or these providers for guidance on this case.
Well, I think first and foremost, well, by the way, good afternoon, everyone. My name is Michelle Martinez. I think first and foremost, we wanted to identify what a safety plan would look like for the client being serviced. And so obviously law enforcement, because there is a clear some trafficking occurring. And I think in order to identify the depth of this trafficking, the depth of potential abuse and exploitation, we would have to obviously create a report. Now, I think if this was from an advocate perspective, in the state of Kansas, advocates are not mandated reporters. And so we would basically throw the ball back on the survivor's court and have them identify if they would want law enforcement involvement. However, if you are a mandated reporter, then I would say obviously law enforcement, because they can have the opportunity to go into deeper reporting. And I think also from we went into another step further ahead, but I think when a police report is made, it opens other avenues to assist a survivor. This could be assistance from the court, assistance from other agencies. This can immediately reflect like referrals to other centers. And this, depending on the migration status of the client, a police report can also be very beneficial depending on what that status looks like, to aid them and seeking their safety and creating a safety plan in case the perpetrator or perpetrators involved continue to try to overpower them. And so I think just kind of jumping to steps 1, 2, and 3, we kind of just wanted to embrace the whole picture and see what housing would look like if we needed to address what our partnerships with social services look like, to identify what those needs, depending on what the client says, what referrals we could make or how we could coordinate so that this person is ensuring safety in all corners of their life. And of course, addressing the health piece of it, right? It's one of the agencies that we mentioned also was making sure that we are giving this client access to like a pregnancy center, because we don't know what their access to service has looked like in the past. And so we can't just assume that they will know whether or not they want to keep the baby, or whether or not they know what prenatal care looks like. And so I think informed care was one of the biggest things that we discussed, is that we can't just assume that the client is informed. And so we have to help them navigate all of those corners, especially because there is a big language barrier involved. So we pretty much kind of just said, hey, we need to cover points A through Z in terms of the safety plan, because we really don't know what they know or what they have been through.
Thank you, Michelle. And I like how you said covering A through Z, the entire safety plan, and certainly what was discussed in your group sounds like, you attempted to do that, thinking not just the immediate needs of the client patient coming in, but what other needs that might have not been discussed, but certainly could be potential. So thank you again, Michelle. Sounds like a great discussion, and thank you all for participating in that. Dr. Mutsa, I'm gonna transition to you.
Yes, thank you, Dr. Brandon. Thank you all to our participants for taking part in the breakout room and having what sounds like really rich discussion. At this time, we'll review some of the key takeaways from this session. So throughout the session, it has been emphasized that a multidisciplinary team can enhance collaboration amongst various professions by bringing together diverse perspectives and skills, leading to holistic and comprehensive solutions. The discussion that came out of the breakout room shines a light on the importance of partnership with key players in the behavioral health care space, such as clinical directors and supervisors, victim advocates, crisis support, and human trafficking specialists. That ties into the point that our subject matter expert, Dr. Trujillo, discussed as a benefit of a multidisciplinary approach, in that it can provide robust solutions for complex cases. Given that many refugees and migrants face many mental health challenges and encounter significant barriers in accessing services, it's crucial to integrate behavioral healthcare into primary healthcare settings. So by offering services such as intensive case management and coordination, this can facilitate a greater ease in scheduling appointments and offering a more streamlined process, which can hopefully yield in more engagement and buy-in per se from your clients who may be wary of participating in treatment overall. All of you have shown up today with the intention of learning, sharing knowledge, resources, and best practices for serving refugees and migrants, which will only serve to benefit the populations you work for and assist them with achieving optimal health outcomes. Today, you were introduced to Sanda and had an opportunity to start working on her care plan. When you return for session 2 of the learning community, you will be presented with more information about Sanda and have an opportunity to continue working on creating a holistic care plan for her. We look forward to seeing you then and continuing with our theme of learning, collaborating, and supporting one another in this engaging environment. And I'm going to turn it back to Dr. Brandon.
Thanks, Dr. Mutsa. And just on that last point about thinking about session 2, if you all have colleagues and coworkers at your organizations that you think would benefit from this learning community, they certainly can join our second session and our third session. They didn't have to attend today. We will be sending out the recording as well as the materials from today. So, everything that you discuss in your breakout room, we'll have like a summary of that, the resources. So, and of course they could reach out to you if they want a summary of your experience as well. But please feel free to share that with your coworkers and colleagues if you think this particular learning community will benefit from them. Now, just on some brief ending notes, we thank you for attending today, but we also ask if you could please fill out a brief survey. This really helps us improve our sessions as well as meet our funder requirements from SAMHSA. So a QR code will be shared briefly and a link in the chat as well. And like I said earlier, we'll be sure to send out some resources, the meeting notes, and notes from your breakout session that discuss that patient care plan. So again, I want to thank you for your time today. Look forward to seeing you in our next session. I'll post that link right now. Oh, looks like Diana already. Thank you, Diana, for posting the survey link. But yeah, survey link is in the chat, and there's also the QR code. We ask that you please complete the survey. And I think Dr. Mutsa, I don't know if you had like some just additional last words. We have our RMTAC website where we offer other types of learning as well as resources for technical assistance. If you have a specific case you wanted to reach out, we have a clinical case consultation service. So our website is rmtac.org. Dr. Mutsa, did you have anything else you'd like to share?
That was perfect. You highlighted exactly what I wanted to emphasize in terms of please make sure to visit our website. We would love to hear more from you. And as Dr. Brandon noted, we encourage you to extend this invitation to your network, to your coworkers, to your friends, and let them know about the value that you got from this learning community, and hopefully that they can join our upcoming session 2 and session 3. And just to wrap up, I just want to again thank all of you participants for your engagement throughout our session. Thank you to our co-host, Dr. Brandon, for assisting with executing this session. Thank you to our project director, Dr. Lizzie, for your opening remarks. Thank you so much to our subject matter expert, Dr. Trujillo, for your insight and expertise on this topic. To our other subject matter expert and facilitator, Karen Johnson, thank you for sharing your expertise. Thank you, Esther, for also assisting in that breakout room, and Luce for your assistance with introducing the case study. Thank you to our observers for being a part of the learning community and sharing your feedback. To the RMTAC team, the producers, everybody who made all of this come together, thank you so much for your support and making this event a success. And we hope that you all have a wonderful rest of your afternoon. We look forward to seeing you all again. We encourage you to let us know your thoughts, submit your feedback via the survey, and you're welcome to reach out to us with the email that is posted on this slide if you want to reach out to us for consultation, technical assistance, anything else we can assist with. So thank you all so much.